Gentlemen, let me ask you something. Have you ever noticed how small changes can make a big difference as we age? Not dramatic changes, not extreme routines, but simple habits done consistently that support the body instead of fighting it. Recently, one of my patients, a 68-year-old retired teacher, asked me a question I hear more often than you might think. Doctor, is it true that honey can help circulation? At first, he sounded skeptical, but curious. And curiosity is often the first step toward better health. Today, I want to explain what really happens in the body when honey is used intentionally, why some men feel a difference in circulation, and how this relates to vascular health, energy, and confidence after 50. This is not magic. This is physiology. The real problem after 50? Vascular slowdown. Most men believe that changes in vitality come from one thing: low hormones. But in clinical practice, that's rarely the full story. What I see far more often is vascular slowdown. After 50 or 60, blood vessels tend to lose elasticity, respond more slowly to signals, narrow slightly due to inflammation or lifestyle, deliver oxygen less efficiently. When circulation slows, everything feels slower. Energy, recovery, responsiveness, stamina. This affects not just the heart, but the entire body. Why the tongue is a unique entry point. Now let's talk about something interesting. The tongue is not just for taste. Under the tongue is a dense network of blood vessels. This area is highly absorbent. That's why certain medications dissolve there. Some nutrients are absorbed faster. The nervous system responds quickly. When something natural like raw honey touches the tongue, it doesn't act like food in the stomach. It acts as a signal. What honey actually contains. Let's remove the myths and look at the science. High-quality honey contains natural sugars, glucose and fructose, polyphenols, plant antioxidants, trace minerals, potassium, magnesium, enzymes produced by bees. These compounds are known to support endothelial function, reduce oxidative stress, improve nitric oxide availability, support gentle energy release. Nitric oxide is especially important because it helps blood vessels relax and open. Why some men feel a vascular response? When honey is placed on the tongue and swallowed slowly, a few things may happen. Rapid sensory stimulation signals the nervous system, encourages parasympathetic balance. Gentle glucose availability supports vascular muscle function, prevents sudden drops in blood sugar. Antioxidant signaling supports vessel lining health. This does not mean instant transformation. What it means is the body receives a supportive signal, not a shock. The right way to use honey, important. If honey is used incorrectly, it does nothing or worse, causes sugar spikes. Recommended method: 1/2 to 1 teaspoon of raw, unprocessed honey. Place gently on the tongue. Let it dissolve for 10-15 seconds. Swallow slowly. Best used in the evening or before rest, not during intense activity. Avoid processed supermarket honey. Large quantities. Using it alongside sugary foods. Expecting instant or guaranteed results. This is support, not stimulation. How this connects to confidence and vitality. Confidence is not psychological alone. Men feel confident when circulation feels reliable. Energy is steady. The body responds naturally. When vascular health improves, anxiety decreases. I often tell patients, your body performs better when it feels safe, not rushed. Honey supports calm physiology, not pressure. Patient story, age 70. One of my patients, age 70, struggled with cold hands and feet, evening fatigue, inconsistent energy. We focused on hydration, walking, sleep rhythm, and small nutritional signals. After adding a small honey routine in the evening, he said, I don't feel wired. I feel smoother. That's the key word, smoother. Who should be cautious? Honey is natural, but not for everyone. Speak to your doctor if you have uncontrolled diabetes, severe insulin resistance, allergies to bee products. Health is always personal. How to support vascular health long-term. Honey alone is not the solution. True vascular health comes from daily walking, balanced minerals, reduced ultra-processed foods, proper sleep, stress regulation. Think in systems, not tricks. What this is not. Let me be clear. This is not a drug, a stimulant, a guaranteed sexual enhancer. It is a gentle circulatory support habit, backed by physiology, not hype. Message, respect, and realism. Gentlemen, aging does not mean decline. It means adjustment. The body still responds when you speak its language. Sometimes the smallest habits restore the greatest confidence. Support your circulation, respect your rhythm, and give your body what it needs, not what it's pressured to deliver. Call to action. If you found this helpful, like the video, subscribe for evidence-based men's health, comment, I support my circulation naturally, because strength isn't about force. It's about understanding.